Hi, I'm Bree Balchunas, and this is Orlando Health News Review for January 29th. This is news for you, by you. Every day, team members around the organization strive to keep our patients as healthy as possible. That purpose is now translating into something more, something that will also minimize the need for emergency room visits and unnecessary hospitalizations and readmissions. It will be a culture change with many new initiatives coming together to make it happen. It will touch every area of the organization. It is our new Population Health and Care Coordination Initiative. Here to tell us more is Dr. Jonathan Ware.
Care coordination is a deliberate, organized healthcare delivery model that Orlando Health is moving towards, that allows us to provide care to the right patient at the right time in the right setting for the right reasons. Previously, we've been more of a reactive organization. So at the time of discharge, it's kind of a scramble to get the patient home. And now it's more of a proactive approach. The triple aim approach is increased quality, increased outcomes, and reduced cost. With care coordination and this model, every team member, every employee, every physician will be affected in a positive way. So from security to dietary, all the ancillary staff, together here at Orlando Health, we are transforming healthcare.
Some of the new features and initiatives of the Care Coordination Program include notice to patients on how long they stay in the hospital and what day and time they can expect to be discharged, implementation of the Rapid Assessment Care Environment Program, or RACETRAC, adding a navigator role in the emergency department, and implementation of a logistics call center. Implementation has already begun for many of these initiatives, and over the next several months, we will be taking an in-depth look to help us all understand the role of care coordination at Orlando Health and how it will help us develop proactive, coordinated, quality health care for our community. Speaking of care coordination, I'd like to share with you a story about one of our team members. Daphne Johnson was checking on a room in the neuro ICU at ORMC when she went rushing out to the nurse's station asking for help. She had gone in to clean the patient's room and immediately noticed the patient was bleeding near the catheter site.
That day, I was just being more alert of things like I always be. And when I saw it, I knew something wasn't right. So that's when I got the attention of the nurse.
Thanks to Daphne, the nurses were able to act quickly by holding pressure and stop the bleeding. Things might have been different without Daphne's quick recognition and response.
Well, her action was pretty much what we expected. They set the standard more than one way. It's not just about cleaning a room every day, not just about coming to work and a 9-to-5 job. They actually show they care. I'm very proud of her for what she did.
While not all of us have a clinical position, Daphne's story shows that we can all impact patients.
No matter clinical, doctors, nurses, they all are our patients. They are our patients.
Thank you, Daphne, for being an Orlando Health champion. If you would like to nominate a team member as a champion or give a kudos, be sure to visit the new recognition site on Swift. Finally, don't forget, this Friday is the Big Service Award event. Stay tuned next week for the coverage of the big event. That's it for today's edition. For Orlando Health News Review, I'm Bree Balchunas.